More than 7 in 10 NHS nurses say they treat patients every day in unsuitable or overcrowded settings like corridors, cupboards, or even car parks. A new survey of more than 5,000 nurses found that patients are being harmed and even dying because of a lack of space and equipment. Alice Porter's here for more on that. That is quite the sobering introduction.
It really is. This report comes from the Royal College of Nursing and it paints an incredibly bleak picture of the NHS. It's based on experiences of more than 5,000 nurses, and it really illustrates just how overcrowded our hospitals are and the lack of staff. Now, the Royal College of Nursing has called for immediate government action to end corridor care, and they say it's become normalised, and not just in the winter months, although of course it is worth stressing that this is a particularly difficult time in the year for the NHS. And reading through the report, the issue of overcrowding, a lack of staff, you really get a sense of what this means in terms of the lack of dignity for patients. And I'm just going to give you a couple of testimonies. One, patients regularly treated in bathrooms, shower areas, and even viewing rooms, and that's where families actually visit dead relatives. A nurse in the South East said a patient died in the corridor but wasn't discovered for hours. At its worst, asking someone to go round and make sure people are still alive. And the final one is we have one cubicle space that is for corridor assessment and toileting, but it's often busy, so delays in toileting resulting in people laying in their own urine and faeces. I mean, that is just so shocking to read, because these aren't just testimonies, these are real people and these are real families' experiences, and it's just shocking to hear. And also the impact on nurses having to deal with that must be so difficult. The Royal College of Nursing General Secretary, Professor Nicola Ranger, says something really needs to change.
Alice.
It is a disgrace, actually. I think the NHS used to be the envy of the world. I think we need to take a long, hard look at ourselves and say what needs to change. And the biggest concern for us is that the public are starting to lose a little bit of faith in their care, and that has to stop. We absolutely have to sort this out. And I think we absolutely agree with the three priorities of this government. But in order to move patients out of acute care into community settings, that will require infrastructure and investment and vital nurses.
Now, NHS England say building a health service that is fit for the future is a key priority for the NHS and government, and the NHS is continuing to work hard to deliver improvements across urgent and emergency care for patients and our staff.
Alice, appreciate the update. Thank you so much.